Thank you, Anne. That was a really good introduction. I think that rather than a periscope, I would say maybe what I'm doing today here anyway is more of a hot air balloon. In that I've spent a little time over the last year, sort of, if we can go back just one slide, sort of sailing over children's palliative care, as Anne says, as an outsider, and therefore I'm sharing today just a little perspective of what we've seen. So thank you for staying on. I will be quick. I always speak to time, and I hope that if we do have any extra time at the end, that we'll have an opportunity. Feel free to ask me questions, but also to hear your responses to these two outsiders to you today. So the simple message of the work that we've done is essentially to encourage and to inspire people working in children's palliative care to think about innovation in their organisations, and particularly in the way that care is delivered. And I'm going to talk about the findings of conversations that we had with leaders of 50 different children's palliative care organisations across 27 countries, about where they thought the best opportunities for innovation were in the way that they were delivering services, what they'd been working on, and where they saw things over the horizon that they thought were really interesting and worth investing in. And marry that with some of the work that I am more familiar with on how organisations in healthcare in general spark, scale and share innovations within the way that service is delivered. And to clarify here that yes, the things we were interested in here is the way care is delivered, the delivery models, the organisations, are not scientific clinical innovations and advances. So as Anne said, I'm an outsider to children's palliative care, although I've always been an advocate for it, and in my personal life have experiences from the teenage sibling perspective of really world-class palliative care. But I spend most of my time now working on the challenge of access to quality healthcare. So most of my time is actually working with governments trying to implement universal health coverage reforms. So my bread and butter is implementing national health insurance schemes and then the delivery reforms that need to follow that. And so across the kind of more than, I think, 30 countries I've worked in now, I have to say, I don't think there have been many other sectors where I've seen such a vast gap in access as with children's palliative care. And the map you'll know there, the statistics there, I'm sure you'll be familiar with. And even those of us from a resource-rich healthcare settings will know that this is not a low-income country problem, that even some of the best resourced and best financed health systems in the world have a bit of a blind spot when it comes to the provision of children's palliative care. We even heard in a session today that Switzerland has things that it can learn and can improve on, which is really surprising because there's not too many things of those in the Swiss health system. And while as a collective community, you know, we've heard today children's palliative care, they're rightly concerned with trying to work towards that parity and that recognition that we need and deserve from governments and payers and the rest of the health system. We've also seen in a lot of the program today that innovation has to be part of the solution as well. And that means the creation, the adoption, and the adaptation of new ways of working, new tools and approaches to improve quality of care and improve access, making the resources that we do have go further and bringing new partners into the fight. So the drive for us personally as a team at Imperial College London to look into this started with a single children's hospice, or rather a soon-to-be single children's hospice, because it's under construction in Bologna. For the past 3 years, they've been working with some health policy people like me and a lot of designers as well to think in sort of broad terms about some of the ways that they could develop new models of care and new ways of working when they come to be service ready, and working on different prototypes. And that interest, though, soon grew from that single provider perspective to the bigger question that you can see there. What does innovation in children's palliative care delivery currently look like around the world? High, middle, low-income countries. And what are the most promising opportunities for the future? And And so Foundation Isabella Serignoli, who funded this work, asked Imperial College's Institute of Global Health Innovation to write a policy paper that would not be the last word on this topic, but that would be helpful in starting conversations with people who work in children's palliative care, but also people who have never thought about getting involved in that as a sector, to start conversations on what the future could look like and what some of the features of future and current innovative children's palliative care look like, and how we can collectively work to bring those about. And the report you see in front of you there will come out in, I think, 5 or 6 weeks. But I thought I would come here and just share a few of the messages, because a lot of them are actually really well aligned with the theme of this conference. So I would say the biggest takeaway for me as an outsider to children's palliative care was actually the sheer volume of innovative practice that happens on a daily basis at the front lines of care through children and family members and staff members themselves, just trying to solve the problems that through necessity they're faced with in creative ways. And whether that's in care coordination or communication tools or the care environment, really, I mean, you can walk around any of the poster presentation here and see examples of these things. And I thought that was really just unique, the incredible volume with which that was happening. And so, you know, while children's palliative care may not be the best resourced area of healthcare, it may not currently be the best researched sector within healthcare. It has a lot to teach other healthcare providers of the kind that I'm more familiar with working in, particularly about that approach of working from the experience and the expertise of users and staff, and particularly in that person-centered care methodology, which, if I'm honest, in healthcare in general, is probably more often a slogan than a reality. Also, particularly in areas around demedicalizing the care environment and care tools, so that they're more human, they're more approachable, they're less traumatizing. I found some incredible examples. And also, to some extent, in the way that I think some staff within some of the children's palliative care providers we talk to are managed, in the way that they seem to have or feel the freedom to be able to use their professional autonomy to creatively problem solve. And none of those things, if your vision of innovation is robots or drone-delivered drugs or artificial intelligence, none of those things feel like innovation. But actually, I hope what Alessandro, who spends much of his time thinking about how innovations come about, will share with us, is that actually in the way that innovation happens in healthcare, it's much more that nature that children's palliative care that we saw very clearly in using the lived experience and expertise of people and basing the problem space on that and the solutions on that. That's much more what innovation is about in really innovative organizations than, you know, shiny machines or big data. The second headline finding for me was that, I guess, despite that very large volume of innovation that's happening on a sort of daily level at the front lines, there's not a particularly refined infrastructure for how that gets shared between providers and scaled up between providers working together. And so, you know, a good idea in one team or one provider, more often than not, might stay there and not benefit or not get invested in and developed. And so there's a real opportunity, we thought, for more focused innovation support for providers that want to work on things together and want to bring in new investment or new expertise into the things that they're doing. And the third headline was then that alongside that kind of very much frontline, sort of low cost or no cost innovation that we found, with kind of families and staff very much having to do things for themselves or no one else is going to do it for them, that there was a real value to small amounts of technical expertise that might be able to be put into that process, whether that's from coders or data analysts or impact financiers or entertainment or gaming people or medtech or other sectors that frankly at the moment spend very little time thinking about children's palliative care. Maybe they think it's too small, maybe they think it's too complex. But what they're not seeing is that there's so many of these ideas already there. They just need to be developed and invested in and commercialized, but not in a way probably that's going to make them any money, but it will have a huge social impact, and that has a value of itself. And that's particularly the case if they're not helping their local children's palliative care provider, but they're working with a group of 10 or 15 or 20 or 50 providers that have said they're invested in trying to solve this problem together. So what else did we find? Well, too much probably to... oh, we haven't moved on. Can we go to the next slide? I might be massacring this clicker. There we go. So on the basis of these conversations we had, we grouped all of the different ideas and innovations that people mentioned into 9 different areas. Each of which we give a kind of summary statement that is not meant to be the final truth on this particular area, but it's meant to be a bit of a provocation to get people thinking and to get ideas and conversations flowing. And with each of those, we attach 2 or 3 case studies of where that's happening in children's palliative care at the moment. And I'm not going to propose to go through each of these 9 here, but I did want to talk about 3 that I thought were particularly aligned with the theme of this conference. And the first of those is vision, which is about who sets the organization's agenda and strategy and what it wants to achieve, and the choices that all organizations and providers have to make between limited resources and seemingly limitless need. And this was actually an area where a lot of the provider leaders we talked to said that they thought they'd really improved in recent years in going from more of a top-down process of setting their vision or their strategy to all sorts of ways where they tried to make that more participatory, whether that's through having users or family members on their boards, having committees of parents or children that they can consult, or running workshopping or surveying exercises as part of a sort of periodic strategy refresh. And they could point to quite a few sort of tangible things that they have done differently as a result of that, changes to their strategy or their vision. But we asked them sort of, do you think there's any further to go in doing that? And a couple of them said, well, yes. We talk to our current users, but that still leaves a really big gap in terms of the people that we think could benefit from our services. And you could imagine if you're in the position of being a provider who you have the resourcing basically to service a fraction of the need that you know is out there. Well, if you only talk to that fraction, you actually get quite a skewed perspective on what your vision and strategy should be. So we talked a little about, well, what would some of the ideas or the mechanisms be to try and get that broader perspective? Because you can imagine it making quite a big difference if you're faced with some of the really difficult trade-offs between, do we expand existing services or do we improve the quality of what we got? Do we consolidate or do we put more investment into advocacy or business development to try and expand the pie? Who you ask will actually give you a really different answer. And so we, in our statement, encourage providers not just to think about what they currently do to involve their users in setting their strategy and vision, but also about what might that mean to broaden that out to those whose needs cannot currently be met. The second area is culture, and specifically the culture of innovation in a provider organization. And the statement here was the culture should be one that institutionalizes innovation, centered on children, families, and staff as the engine of ideas, which the organization's job is to scale up and share. And as I said before, in general, across the providers we spoke to, we found a huge array of those ideas and innovations in working in practice at the front line, but no real systems to kind of scale up and share those in a systematic way. And so this was one of the areas where we looked to elsewhere in healthcare for some ideas, and particularly to a series of 4 studies which Imperial's Institute of Global Health Innovation did over 6 years, trying to look at healthcare organizations that were really good at adopting, adapting, stealing, implementing, creating new innovations. And they came out with 4 ingredients that they thought were particular features of these providers. And the first one was that they had a really clear philosophy that everyone in the organization could articulate about innovation in that organization. And that means not just that it's encouraged or it's praised, but there's a specific methodology that people are encouraged to follow. And Alessandro will talk a little bit about one methodology that we have found, which is they called it human-centered design. He often calls it user-centered or co-design, which we think is a really good fit for the types of things that need doing. The second ingredient was to train your staff at all levels in the team that are doing that, so that there's a shared language and an expectation and an approach that when there's a problem that needs to be solved that's going to have an impact on user experience or outcomes, that methodology kicks in and should be used. The third was that they bring in a degree of outside expertise, whether that's as designers or other expertise, to help people to formulate different ideas, refine them and prototype them, recognizing that not all the skills exist within the care sector, but also that there isn't always the time. And then the fourth was to connect with organizations whose sole remit is the scaling and sharing of innovations and helping providers to find others that have similar challenges, to find funding, to find the researchers they want to work with, to find the outside expertise they need. And that those platforms were really important at acting as a clearinghouse and a filter for that. And then the third and final area that I will talk about is technology, which is, I'm sure, an area where we just scratch the surface, because I'm sure everyone in this room has got stories over the past 2 or 3 years of having to rapidly innovate using technology in response to the pandemic. And you'll be having those conversations now also, I'm sure, about, well, what of what we just did is an emergency measure that we can roll back on, and which of these things is actually something we want to develop further and invest in for the future. So we saw in our interviews just a huge range of potential applications for digital tools in children's palliative care, whether that was e-consultations or different psychosocial support activities or play, or connecting parents with the information that they need about their child's care. And really, you know, even without the sort of newer technologies, which we've seen some of in the posters, like virtual reality or augmented reality or 3D printing, which is something Alessandro has a great example of, you know, just with sort of basic, new, you know, fairly established tools in terms of phones and apps, there's so much potential still to be unlocked, you know, for all sorts of problems like supporting independence of older children, or trying to help parents with decision aids, or automating repetitive tasks that staff and families have to do, these kind of things. We saw a couple of providers that had created dedicated data managers within their hospice environment to manage that process of moving towards sort of data-driven care. And also had a case study of the amazing work that ICPCN and other partners have done to create and implement and then gamify the children's palliative care outcome scale, which is just a fantastic example that she'll tell better than me. And in newer technology, we did give some examples as well of different prototypes of things that actually the Helix Centre at Imperial had been working on. Connected garden with plants that are sort of able to interact with children, and an augmented reality game that uses a very simple face and head tracking interface that works off of an iPhone, a memory making platform that allows staff and family to sort of in real time be collecting and curating memories. All of those things were sort of done with Helix, but also with their partners in Italy. And so I'll hand over to Alessandro now to talk us through some of the practical examples that he's been working on and prototypes. But just to say, we're really interested to hear not just any questions at the end, but your reactions and your thoughts on this. Our focus now, as Imperial, is going to switch to that particular problem around what sort of platform or platforms would be helpful at getting people from within and without the children's palliative care sector to better connect and interact and work together on innovation challenges. So we hope to be able to sort of launch something that will do that, and equally would be really interested in your ideas about how we crack that problem as well.